In this session, we will discuss how you'll be able to tell if your baby is feeding well. We look at three main things when we want to determine how baby is feeding. The first one is the amount and quality of your baby's feeds. Remember that responsive feeding is the way of feeding that will allow baby and yourself to get and produce the right amount of milk. But still, you would count the total amount of feeds in 24 hours. In the first 24 hours, your baby will have at least 4 full feeds. After those first 24 hours and from then on, babies will feed a minimum of 8 to 10 times in 24 hours. But you do not count how often those feeds happen. You just add up the total amount of feeds that happen in those 24 hours in one full day. You will also look at how your baby behaves during the feed. So you would like to see your baby being calm at the breast and then contented after most feeds. You can also look at the length of your baby feeds, for how long your baby feeds, and that would be typically between 5 minutes and 40 minutes. If your baby feeds for less than 5 minutes, you wouldn't really count it as a full feed. Possibly baby was just thirsty or came to the breast for comfort, which we already learned that is fine. And then babies usually go to 40 to 45 minutes as well. So in between there can be, baby can fall asleep, baby will be taking breaks, and that's totally fine. And you will know that the feed has finished once the baby lets go of the breast and looks fairly contented. Maybe you're thinking that 8 to 10 feeds in 24 hours, it can sometimes be even more than that, is very, very frequent. But please remember that when baby was inside the womb, it was never hungry. It was receiving food continuously, and baby will start regulating itself in terms of its hunger. But remember as well that babies have tiny stomachs. If you look at the image, you will see how small baby's stomach is and how it slowly starts growing as baby starts feeding more and more. Baby feeding frequently, coming frequently to your breast will mean that baby is going to be sending loads of messages through the breast to your brain, ordering the production of a lot of breast milk. And baby will also be removing milk frequently from the breast, which we know is very important also for a great milk supply. Keeping account of your baby's nappies is another way to tell that breastfeeding is working, because what comes in needs to go out. So one of the things that you will be looking at is your baby's wet and dirty nappies. The amount of wet nappies that your baby should have every day is easy to remember, because they grow as days go by. So in the first 24 hours, you expect your baby to have at least 1 to 2 wet nappies. On day 2, 2 to 3. On day 3, 3 to 4. On day 5, 5 to 6. And from day 6 onward, your baby should have at least 6 wet nappies in 24 hours. The dirty nappies remain around the area of 2, at least 2. But your baby can pass poo many more times in 24 hours, many more times than that, and it would not mean that your baby has diarrhea or there's anything wrong with baby. But you will keep an eye on the color of baby's poo. In the first couple of days after the birth, your baby's poo will tend to be black color and very sticky and tarry. It's kind of a tarry look poo. Day 3 to 4, you will see a change and the poo will become kind of an olive color. And from day 5 to 6 onwards, you will already want to see that your baby's poo is already yellow. And this means that baby is digesting your breast milk and it has eliminated all that poo that it has been producing, the stools that it was producing during pregnancy, and now that your baby is already digesting your milk, and that's why the color of baby's poo will be lighter. There are other signs that will tell you if baby is feeding well. One very important one is baby's weight. Even though baby can lose some weight during the first week of life because it will pass the stools that were inside its gut and it will lose some fluids from its body, it will eliminate those fluids. Your baby should start to put on weight gradually after the first week of life. A very important part of how breastfeeding is working has to do with how comfortable your breasts and nipples are. It's important that breastfeeding is comfortable for you. Pain is not part of the picture, and it is actually an indication that something is wrong. It may mean that you need a little bit more support in terms of helping your baby achieve a deeper latch, but pain should not be part of the picture. Maybe the first few seconds of a feed can be a little bit uncomfortable, but once the baby has formed the teat inside its mouth, you should feel fine. If you are experiencing pain whilst breastfeeding, it's important that you request support. You can contact your midwife, a peer support group, a breastfeeding counselor, or your health visitor. They can look at you and your baby feeding and make suggestions in how to improve the latch, or if you need any other sort of intervention, they will surely be able to help.